Good morning, everybody. And this is Dr. Vignesh Kumar. After a long time, I am going to speak about the reassurance and education for the chronic low back pain patient. I had seen a recent article. Do the physiotherapist is giving reassurance to the chronic low back pain patient? The paper recently published in Western Australia by Ian Powell and Peter Sullivan et al. So I have gone through this 18 pages article for the past 1.5 months and studied. And I came through this word reassurance, which I used to prescribe in the OP seat of patient who used to bring when I was working in government general hospital in 1998. My orthopedic chief used to write NSIDs, physiotherapy, and in the last third point, reassurance. So I was wondered, he is writing reassurance. So it's a sum of a treatment like that. I was wondered, and I used to ask a patient what doctor said. Doctor is saying that take this medicines, do go to physiotherapy, and just get checked with them, and they know that how to treat you, teach you exercises, all those things, and by taking all those things, you will get all right. Don't worry, don't get fear. So this is a simple way of giving a positive delivering message to reduce the fear and anxiety. So what a wonder thing that it was happening on those days itself. So I was wondering, 100 patients he used to see in the OPD, each and 100 patients, among them 20 to 30 patients with chronic low back pain or acute low back pain, he used to write a reassurance. So this reassurance, the nice guidelines 2018 also it was published. It is very important thing, that aspect, a tool which has to be handled by physiotherapist for chronic low back pain is concerned. So reassurance is very important part. So talking to the patient, so very important is talking to the patient, and just taking the details and giving an assurance that it will get all right. Don't worry, it will get all right. So by their concerns about their individual conditions, it's an important way of reassurance. Reassurance is basically remove the fears and as per the concerns, so decreasing the distress and their apprehensions on the particular conditions, and modify their patient's thoughts, and as well as the change of the behavior and adamancy, because they never used to bend forward, they used to be afraid in the back pain. So all those things which can be reduced, and reassurance based on patient concerns and communications according to the individual patient needs. So this is very important aspect in reassurance. And main important aspect for the low back pain is concerned, there are two types of reassurance. One is affective reassurance and another is cognitive reassurance. The affective reassurance, which shows an empathy to the patient according to the concerns, a positive words, don't worry, the problem is not much serious, it will get all right. So hurt is not equal to harm. While you are bending, if you feel hurt, that is not harm. So whatever the don't, so all this positivity which gives a best, I mean 50% relief for the patient, this is affective reassurance. Once you go for a cognitive reassurance, you have to speak with the patient, so very clearly about the evidence-based information about the condition. For example, patient, make them understand why they should not worry. We are gently saying don't worry, but why they should not worry? Because they used to worry about the neighboring patient. They will give some informations that I had taken a scan and I used to get, say for example, recommended for the surgery, so I had undergone a surgery. So all the patients are heterogeneous, they are not homogeneous. So everybody will have a different problems, but your problem is very simple strain. So don't get worry about this type of a positivity. And whatever the imaging which shows, all this are very common as we age, how the hair which is becoming gray. So as our bone get degenerated, so we should not get worry about the disc bulging or protrusion, all those things. What your symptoms is saying, it's a simple strain. So by teaching an exercises, be active. So nothing is harmful for being active. So don't take much rest, be active as it is. Partially you can start doing the works. So it's very common, which will automatically increase more positivity and reduce the recovery period of a time. So the positivity which has been enhanced by speaking with cognitive reassurance. So that is by the education about the correct informations which has been given. So affective and cognitive reassurance is very important tool by treating the patient along with the education in chronic low back pain patient is concerned. So every physiotherapist must indulge this also into your daily routine practice in your setup, government setup or corporate setup or private setup. If you do it, so the recovery period will be automatically reduced. The patient will give a positivity. So thank you one and all. Please watch and feedback. Thank you.